Hi everyone, I am Dr. Harish Babu Reddy, Consultant Gastroenterologist at Bangalore Institute of Digestive Sciences in Bangalore. Today I will be discussing about the most common presentation why people visit a gastroenterologist is a gastritis. In medical term, we call it as a dyspepsia, which actually means that bad digestion. So gastritis is a most common word which many of the patients when they come to us they use it, but which they mean is either they have a pain in the upper abdomen, or many of them have a bloating or a discomfort after having a meal, or sometimes even they can have an early satiety kind of a symptoms, and sometimes they can have a burning sensation. All this complex of symptoms in combination we call it as a dyspepsia, but the most common reason for this dyspeptic symptoms is called as a functional. So 70% of the patients who come to gastroenterology OPD who suffer from gastritis or a dyspepsia issue are mostly related to the functional. But however, remaining 30% of the patients are the most important ones who will be presenting it as a symptom, but they would be having an underlying reason to come out as a gastritis. In that, the most common thing what we see in our day-to-day practice is related to the gastroluminal structures. Most of the time it will be related to the peptic ulcer disease, or they can have a symptoms related to gastroparesis, or they can have even sometimes any cancers in the food pipe or stomach. And the second most common reason what we find in our day-to-day practice is medications. Either it could be related to the painkillers or any iron or a calcium supplements, diabetic related medicines, and sometimes the blood thinners used in elderly people with a history of stroke or heart related issues. Third, the most common reason what we see is associated diseases, like people will have issues like diabetes, hypothyroidism, or a kidney related diseases which eventually causes gastritis symptoms when they are not in a proper control. The fourth common thing we see is diseases related to the pancreas, biliary tract, or a liver. Even those patients also come to OPD as a symptoms related to the gastritis, related to the gallbladder stones, any liver related issues, or even any diseases related to the pancreas problems also. This is the reason why even though people are coming to us with a mild gastric symptoms, sometimes based on the patient condition, we always undertake some of the investigation to rule out these conditions, because sometimes it's all important to diagnose the other diseases in early stages, because it can be a surrogate symptom in kind of underlying bad conditions. Now coming to the investigations, what we do in a specific group of patients who come to us with a gastritis. To start with, we usually go with a screening of a routine blood investigations, which include complete blood count. In that we are more concerned about hemoglobin value, platelet count, and even a MCV value, which tells us that is there any underlying blood loss from the condition what is presenting to us. Second is we do liver function test to see that any diseases related to the liver or gallbladder, and also we look for thyroid, lipid profile, and HbA1c for a diabetic diseases. And second most investigation we do is for the patients to check for any food related allergies. In the northern part of the country, northern patients we get to see most of them have a celiac disease which is related to the gluten allergy, and most common second thing is we get to see lactose intolerance in the symptoms. For them we do any breath test related to the lactose intolerance. Third, we always order an ultrasound scan to rule out any diseases related to the liver, gallbladder, and the pancreas to screen them clearly. Fourth, an endoscopy is something which is required in most of these gastritis patients, depending upon the symptoms. When they are not kind of improving with the conventional medications or not improving with any dietary and lifestyle changes, we kind of follow up these patients and go for an endoscopy. But in few patients, even in their first presentation, based on any of the alarming things, based on the any symptoms which are suggesting to us that these patients might require an upright endoscopy, we ask them to go for an endoscopy to rule out any other diseases which are masquerading as a gastritis symptoms. Those are the people more than 50 years, they have a symptoms which have come recently. Second thing, whenever there is a family history of any gastric cancer or family history of any food pipe or esophageal cancer, we go for a screening in them directly. And if a patient continues to have symptoms despite being on a medication, and the patients who have persistent vomiting who are losing weight unintentionally, who have difficulty in swallowing the food or who have a pain when they are swallowing the food. Third, patients who present to us with any symptoms suggestive of bleeding, whether they have a black color stool or whether they have a fresh bleed in stools, and sometimes even on a stool occult blood. If the test comes positive, we recommend them to go for an endoscopy. And anyone who has a lump in the upper abdomen, who has a kind of a mass feeling in the upper abdomen, or who have a low hemoglobin in the blood test, these are the category of patients in whom we go for an endoscopy upright and diagnose the condition accordingly and treat them. Remaining patients whom we consider more as a functional, with them we kind of deal with the dietary lifestyle changes and give them a trial of antacid for 2 to 3 weeks. Then if they are not improving, in those patients we selectively consider for an endoscopy to rule out any other causes, at the same time to check for H. pylori infection. We take a small biopsy from the stomach which can be used to check for H. pylori test and treat it accordingly.